Physical therapy providers say they're losing a massive chunk of their reimbursement money. It's through Michigan's largest health insurance company, Blue Cross Blue Shield Michigan. It's because of a new policy that goes into effect next month, and experts say it could cut reimbursements from PT clinics by an average of 17%. News Channel 3's Autumn Pitcher spoke to local providers who say this could have detrimental impacts on clinics and patients.
I spoke with Armor Physical Therapy today, and they are very worried that these reimbursement cuts will force physical therapy clinics to close here in Michigan, including their very own.
15 seconds.
Scott Miller, Regional Director of Armor Physical Therapy, is worried what the future holds for his and other clinics in Michigan.
Some of these clinics may end up having to close because they can't afford to stay open.
Just for a few seconds, yeah.
Miller says it's because of a new policy being implemented April 1st by Blue Cross Blue Shield Michigan that would result in an average 17% reimbursement cut for PT clinics.
It could definitely impact the patient's ability to find quality health care, physical therapy in particular.
Miller says the cuts will also make it challenging for clinics to pay competitive wages to their employees in an industry he says is already a revolving door.
It seems like that it's always an uphill battle with having and retaining, not only recruiting but retaining quality physical therapists.
Blue Cross Blue Shield Michigan says the policy change is part of its response to rising costs in healthcare. Just last year, the company reported its biggest loss in a decade, $1 billion, citing price escalation by the pharmaceutical industry and greater utilization of medical services as the primary causes. Miller, however, believes the cut will do the opposite, increasing healthcare costs to Michiganders.
There will be a huge potential impact that it will impact copays, deductibles, and again, the cost ends up going back to the patient who already is paying higher premiums every year for healthcare coverage.
Miller's CEO sending this letter to the insurer.
Blue Cross has refused to have sit-down conversations to go over this, so it's gone to really trying to get patients to advocate for themselves. Help advocate for us. We're advocating for ourselves as well.
Now, I did hear back from Blue Cross Blue Shield Michigan late in the day today. I want to read you a statement they provided us. It says in part, quote, "Making this policy standard on both our commercial and Medicare providers makes sense, ensures that reimbursement reflects actual resource use, and prevents duplicate payments for overlapping healthcare expenses." Now, Blue Cross Blue Shield Michigan did also confirm with us that that policy will go into effect on April 1st. We will have this statement in its entirety on our website for you. That's WWMT.com. In Kalamazoo, Autumn Pitcher, News Channel 3.